Hello, everyone. My name is Tiara Brooks from School-Based Health Alliance. We would like to thank everyone for attending today's webinar titled Children's Health and Education Mapping Tool, an Introduction and Basic Demonstration. The objective of this webinar is to introduce the mapping tool to potential users and provide a basic understanding of the tool's core functions. But before we get started, we have a few housekeeping reminders before we get started today. If you are viewing as a group, please go to the chat window in the question box and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the question box located in the GoToWebinar control window. We will address questions following the presentation. Attendees also will be asked to complete evaluation poll questions at the end of this webinar. Please let us know how we are doing. Your feedback is very vital in helping us craft presentations that will meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Plus, also visit School-Based Health Alliance for additional archived webinars. Now, I would like to introduce our presenter today, Erin Scheller. Erin is the Research and Evaluation Manager at the School-Based Health Alliance. Erin earned her Master of Public Health degree from Johns Hopkins Bloomberg School of Public Health, focusing on professional epidemiology, program planning, and evaluation. She has an undergraduate degree in anthropology from Washington University in St. Louis. Erin has a background in maternal and child and reproductive health, including work with Child Trends, the San Francisco Department of Public Health, and the United States Agency for the International Development. As a nurse trained at the University of Pennsylvania, she has on-the-ground experience with a variety of patient populations domestically and internationally. But before I turn it over to Erin, we would like to get to know a little more about who is joining us today. We would like for you all to take one quick poll question just to know who is on call. Please select from the category or categories that best fit your organization and field of work. Please take a few seconds. Thank you, everyone. I see we have about 45% are hospital or community health organizations, and we have school-based health, state affiliate, or government programs, 27%, 18% research, 14% federal agency or funded organization, and 5% national public health organization. Thank you, everyone. We now would like to practice using our question box. Please, in the question box, we would like to know how you'll be using this wonderful mapping tool in the future. If you can please type in your response. Once again, please use the response in the question box. Thank you, everyone. I will now turn it over to our presenter, Erin Scheller.
Thank you, Tiara. Good afternoon, everyone. Welcome to the first official introduction and training on the Children's Health and Education Mapping Tool. I'm excited to introduce the new tool on behalf of our team, including Haley Lofink-Love and Samira Solomon-Poor from the School-Based Health Alliance and our partners at Health Landscape. The Children's Health and Education Mapping Tool was released in conjunction with the 2013-14 School-Based Health Center Census Report last week and allows users to interact with their census data in a whole new way. This afternoon, I will give a brief overview of the tool and some background for its development, our goals for how the tool can be useful for the school-based health field and others interested in advancing children's health and education, and what you've all been waiting for, a demo and introductory level training. We'll save lots of time for questions at the end, and during the demo you can feel free to chime in with any questions, and Tiara will try unmuting you all so that you can speak as well.
And also thank you for your responses. So hopefully by the end of the webinar, everyone will know what they're going to be doing with the tool in the future. So we hope that this tool will be very helpful.
So what is the Children's Health and Education Mapping Tool? It builds on the power of geographic information systems technology for data-driven decision-making for those who are interested in chronic inequities among low-income children and the social determinants of health. Indicators of children's health, education, and socioeconomic status at the county level can be searched, mapped, downloaded, and compared to national averages. Public school-based health centers and other health facility locations can be mapped and filtered and key characteristics displayed. The tool can be used to assess community child and adolescent health, identify areas of need, and target new services, examine characteristics of schools, collaborate with and learn from local peers, advocate to policymakers, and fundraise with effective data and visuals. The tool is free and available to a wide range of audiences. We'd love to hear about your ideas for how you might use the tool in your work, as Tiara mentioned, and we encourage you to stay in touch with us as you begin using the tool at research@sbhforall.org and via the forums on our web pages. Please help us spread the word. So the goal for the tool is to support stakeholders across different sectors who want to address inequities in children's health, education, and well-being. The vision all along has been to bring together a variety of data on child and adolescent health that's normally in distinct silos, including specific information on school-based health centers. We want to make information about the wide variety of social and other determinants of health readily available to help think upstream about interventions and policies. So the tool uses a social determinants of health lens. As Robert Wood Johnson, CDC, and WHO say, where we live, work, and learn influences our health. Addressing social determinants has been something that the school-based healthcare field has been doing for decades, and the mapping tool brings this lens to bear by including data on upstream issues affecting health, including violent crime rates, housing, and education. Some of you might know that the seeds for this mapping tool were planted years ago, and we're really excited to finally be bringing it to the field. We feel that by making GIS technology available to a wide range of different stakeholders, they will be able to adapt to this new technology and use it for their different uses. We also want to gratefully acknowledge all of the funders of the tool, including Aetna Foundation, the Bureau of Primary Health Care, Atlantic Philanthropies, and the Bechtel Foundation. This summer, we engaged over 40 participants in a pilot to strengthen the tool and our training information, including some of you, and we look forward to continued feedback on how the tool is used. As we launch the tool, we're excited about its potential to help us build on our More and Great goals to grow the number of school-based health centers nationally by 30%. We know that having examples of how the tool has been successfully used will be vital for helping users be creative in how to guide public health planning and decision-making. We look forward to engaging many of you as early adopters to provide feedback on the tool, as well as serving as example cases for blogs, trainings, and videos. We've said all along that one of the main limitations of the tool is your imagination. We've been framing the tool as having 7 key functions related to public health. I'll introduce them here briefly, as well as some of the data in the tool, and use the key functions to guide some examples as we walk through the live tool. The first function we framed is assessment. Users can use the tool to see how a community compares to surrounding areas on a variety of different indicators of health, education, and socioeconomic status. A user might use the tool to ask about counties in their state that are underperforming compared to the national average across indicators like insurance and high school graduation rates. The next main function that we've thought about is identify. Users can use the tool to identify areas with access to health services as well as shortage areas where they might want to target additional services. Facility-level data for public schools and school-based health centers can be further explored, as well as the locations of federally qualified health centers and lookalikes, medically underserved areas, and healthcare professional shortage areas. A user might ask about counties that have the highest level of need in their state. The next main function we framed is planning. Users can target areas that have been identified as having high need across different indicators with new health and social services. A user might ask, after they've determined which counties have high obesity, food insecurity, and eligibility for free or reduced lunch compared with the national average, and a variety of different public schools, whether an SBHC might be an important service to add to the area to help improve children's health. Users can also use the tool to examine public schools and school-based health centers based on some key characteristics like population size, grade level served, school-based health center staffing profiles, and hours of operation. A user might ask which school that serves adolescents and receives Title I funding might be the best location for a new school-based health center. The tool can also be used for collaboration. Users can use the tool to collaborate with local organizations to coordinate care, identifying communities that might have strong population health outcomes already, and learn from them. A user might ask where there are other service providers in their community and how they can connect with them to discuss challenges or share creative solutions. Lastly, the tool can be used to raise awareness. Users can print maps that were created during the rest of the process and take them to key stakeholders to help demonstrate need for new services or expanded services in their community. Lastly, the tool can also be used for fundraising purposes. Data from a variety of sources are easily accessible here, so users can extract data tables or maps and use them in support of grant applications or reports. Next, I'll touch briefly on some data points. What are the data sources for the tool? What are the different data included in the tool? And what are some of the limitations? The data come from a wide variety of different sources, including the U.S. Census, the Centers for Disease Control and Prevention, the Robert Wood Johnson Foundation, SAMHSA, and the School-Based Health Alliance's Census of School-Based Health Centers. Now I'll talk briefly about the data points that are in the tool. Health insurance and coverage indicators include percent of youth under 18 who are on Medicaid or CHIP, as well as percent under 18 who are uninsured. Health indicators included teen birth rate, percent obese, food insecurity, and the chlamydia rate. Education indicators include the percent of adults with no high school diploma. Demographic and socioeconomic indicators include percent of students eligible for free reduced lunch, percent of kids living in poverty, percent of kids in single-parent households, and percent of households with severe housing problems, and the violent crime rate. All of the data that I've just mentioned are available at the county level for each state. Public school locations, as well as whether they are eligible for Title I funding, school enrollment, grade level served, and free or reduced lunch eligibility are also available. Data on SBHCs include their location, their sponsor type, staffing models, hours of operation, populations that are served, whether the SBHC serves adolescents, their grade levels that they serve, and free or reduced lunch. Healthcare facilities and shortage areas data include location of U.S. hospitals, FQHCs and lookalikes, location of rural health clinics, as well as substance abuse treatment centers. HPSAs and medically underserved areas are also included. I want to touch briefly on some of the data limitations of the mapping tool. County level data is the most discrete geography with data in the tool, but there is an option to upload your own for more local data. For instance, if you wanted to look at poverty rates by census tract within your county, you can upload these data points. Our website and the resources section of the tool describes each of the data sources in more detail. But the data come from different sources, so there might be specific counties that are missing data for some indicators, and years are not the same across all of the different data points. The tool looks at data at a point in time and is not longitudinal, so it cannot help explain why there might be a county that is underperforming on a particular indicator. Lastly, the tool does not have the ability to capture or test for statistically significant differences between counties or states in indicator values. So next, I'm going to get to what all you've been waiting for and really dive into the tool. Going to the tool, I'll walk through our web pages later, but this will be the web address where you can access the tool yourself. We would like to now give everyone the opportunity, if you can also now use the question box to just indicate what state you're from. Thank you. I encourage you to go ahead and type in any questions as I go through the demo. I can certainly come back at the end. We'll give plenty more time for questions. One general note, the tool does work best in recent versions of Mozilla Firefox. So I'm going to give a brief introduction and then walk through a more detailed public health scenario. But first I want to start by thinking about using the tool for the Alliance's goal of expanding the school-based healthcare field. This tool has the potential to identify nationally counties that are underperforming across multiple indicators of child health, education, and well-being. So we can look at where school-based health centers are now, as well as schools, and dive deeper to learn about some of those schools. Think about underserved areas and potential partners. So the tool can look nationally or at specific states, but I'm going to start by thinking nationally. So the very first time that you go to the tool, you'll see this pop-up screen. And down here you can select if you want the window to show every time. I'm going to go ahead and select all so that I can look at the entire United States. And you can see that it is still loading. And you can see that here. So the very first layer that opens up is the child health and education indicators. And there are three main layers. This layer allows you to select a state or the whole country and search, map, compare, and download county-level data on child health, education, demographic characteristics, and socioeconomic status. So when I scroll down over here, I can see all the different indicators that are available within this layer. So I'm going to start by selecting the percent of children under 18 who are on Medicaid or CHIP. When I click on this checkbox, it's set to automatically compare to the national average, which is about 36% of kids who are on Medicaid or CHIP. Counties will become highlighted in blue if they're underperforming compared to the national average, meaning that they have more children on Medicaid or CHIP. So here in the legend on the bottom left, you can see what indicators you've selected. And we see that there are many counties across the United States that have been highlighted on this first indicator. When I hover over a county that has been highlighted with whatever indicators I picked, you can see a little bit of additional information. So I can see the county name, the population, the youth and school-aged population, as well as the number of public schools, school-based health centers, and a little bit of basic demographic information. So looking at some other high needs, I might also think about adults without a high school diploma and select that indicator as well. And maybe I also want to look at poverty status. So as you can see, when I select additional indicators, the counties that have been highlighted will appear in darker colors where they're underperforming compared to the national average across multiple indicators. So the way this works is kind of like, for those of you who remember overhead projectors, where you're layering colors on top of one another. So the darker grays and blues are the counties that are underperforming across all of the indicators that I have selected. I'll also point out down here on the bottom right, the high needs area identifier. This is helpful because I can hover over a bar, for example, for 3, since I've selected 3 indicators, and it will tell me the number of different counties that are underperforming on all 3 of the indicators I've selected. So here we can see that there are about 1,100 counties nationally that are underperforming compared to the national average on each of these different indicators. If I click on this bar, then these counties will stay highlighted even as I move to the next layer. So I did want to also point out that you are able to move the comparison benchmark. So for example, if I was looking at a particular state and wanted to set the comparison to the state average, I could do that, and you can just click on the ball and move that using the keys, the arrow keys on your keyboard. You can also find more detail about each of the indicators by clicking on the information button. And that will show you the definition and data source for each of these particular indicators. So now that we've identified some high need counties based on these indicators, I'm next going to move to the second layer, which is the SBHCs and school characteristics layer. This has data on public schools and school-based health centers. I'm going to start with school-based health centers. So when I click on the checkbox next to that, it will highlight all of the school-based health centers that we know about nationally for the 2013-14 census of school-based health centers. If I scroll over to the right here in my legend, I can see that the green SBHCs are those that provided us with census data, and those in bronze are ones that did not. So again, we appreciate all of you supplying your data along the way. That's important because there are some options here to filter. So for example, if I wanted to see only school-based health centers that are sponsored by a federally qualified health center, I can select that and it will filter out all of those school-based health centers which are not. If I wanted to again show everything, I can just go back to reset and show all. So we can see that there are some high-need counties in the U.S. That potentially do not have a school-based health center. You can also see public schools here. So there will be a lot that show up. You can see that the U.S. is well covered with public schools. So one thing that's interesting here is that you can also click on a particular public school and see some additional information. This example didn't have a lot of data available, but for many of them you can look within the pop-up boxes and see information about the school district, whether it receives Title I funding, and a little bit of basic demographic information. You can do this much the same thing with the school-based health centers and look at a pop-up. So the third main layer is the base maps and optional layers. So among other functions, this allows you to add the locations of hospitals, federally qualified health centers and lookalikes, rural health clinics, and areas that meet the criteria of being medically underserved areas or health professional shortage areas. So the first thing you'll see here is some base maps. So this is interesting because you're able to change what the basic map underneath looks like. So if you wanted to see a topographic map, you could do that. That might make it more visually interesting for some people. You're also able to provide some additional labels, look at streets. I'm going to go back to our default, which is Canvas with labels. Scrolling down, you also have the option to add some additional borders for counties, states, metro areas, or cities. And you can also add labels. So here we can add the labels for all of the different states if we wanted to. You can also add different healthcare facilities. So if I click the checkbox next to hospitals, and I realize this is overwhelming since we're looking nationally, this is where it'll be interesting to zoom in at a more discrete level. You can see short-term hospitals, critical access hospitals, as well as other hospitals displayed. We also have some markers of different health policies. So you can see whether or not a county has a shortage of primary care health providers, which is something that's defined by HRSA and set to an average nationally. Additionally, we see state SBHC partners. So we can see states that might have a School-Based Health Alliance state affiliate organization, or states that have a state government program office that's helping to provide funding or technical assistance for school-based health centers. So I'll also highlight that within tools, you can upload your own address data or data for across an entire geography, such as a county or a zip code or a census tract. This Community Health View also has some additional publicly available data points that you can use. I'll also highlight that here in the Resources tab gives you some links to additional training resources on our web pages. So were there any questions that are urgent? And otherwise, I'm going to go ahead and reset this so that we can walk through a state example using a particular public health scenario. So now I'll walk through an example to demonstrate some of the key functions of the tool that we talked about. For those of you who might be new to using a geographic information system, this exercise provides a basic introduction to thinking geographically and visually about public health issues. And I'd like to just note that while this scenario is based on publicly available data, this is only an example, and a comprehensive strategy should incorporate some local context, including perspectives from local stakeholders, additional data, and we really appreciate Arkansas being the pioneer example state for us today. So in this public health scenario, you're an adolescent health advocate working to reduce teen births in Arkansas. The national teen birth rate is 26.5 births per 1,000 females aged 15 to 19 and varies by state, but is particularly high in Arkansas. You are working collaboratively with representatives from the Department of Education and the Department of Health to develop a comprehensive strategy to address this issue because it can influence the number of young people who are completing high school and is particularly prevalent among low-income communities. You've recently learned about the School-Based Health Alliance's Children's Health and Education Mapping Tool and want to explore how it can be used as part of the process to tackle this public health problem. Your goal is to bring information to your state legislators to convince them that it's time for the state to consider expanding access to sexual and reproductive health services. Excuse me. So the first question that you and the local task force want to address is whether or not the teen birth rate is higher than the national average in all counties in the state, or if there are specific counties where the issue is particularly prevalent. So to do that, I'm going to select the teen birth rate as one of my indicators. Again, the sliding ball here is set to the national average for the teen birth rate. So we can see that many counties in Arkansas are underperforming compared to the national average. Next, I might want to identify counties where children and adolescents are living below the federal poverty level and where fewer state residents have completed their high school education. So I'll select this second indicator, which is percent of adults with no high school diploma. Again, we see a few pockets where counties are not highlighted, but most of the counties, it looks like, are underperforming across both of these indicators. So lastly, I'll also select percent of kids in poverty. For my high needs area identifier, I'll hover over the bar for 3, and I can see that there are 60 counties in Arkansas that are underperforming across all of these indicators. I want to find out a little bit more about some of these counties. So I'm going to hover over them so I can see my pop-up yellow box that provides some additional basic demographic information. Now that I've identified some high-need areas in Arkansas, I want to know which areas meet the criteria of being medically underserved areas. So I'm going to go to the base maps and optional layers and scroll down to health policy. Then I will go and click the checkbox next to medically underserved areas. I can see not just the medically underserved areas in Arkansas here, but I can also see that there are medically underserved areas in many of the surrounding states as well. And for those of you who may be less familiar, medically underserved areas helps capture whether there are too few primary care providers, whether there's a high infant mortality rate, high poverty, or high elderly population in these areas. I can see that some of the perhaps more urban areas around Little Rock are less covered by these medically underserved areas, but maybe some of these more rural areas have more medically underserved areas. I also want to know whether there are any primary provider shortages in Arkansas. So I can look at this health HPSA as well. And if I scroll over in my legend, again, I can see this primary care health professional shortage areas that are shown in green with the hash marks. And it looks like southeast Arkansas might have a few medically underserved areas, as well as HPSAs for primary care, and it's being highlighted with a lot of these high-need counties that we identified through the Child Health and Education Indicators layer. So after conversations with experts and reviewing the Community Preventive Health Services Task Force recent recommendation that school-based health centers can improve health outcomes and access to services, you and your local task force decide to establish and strengthen SBHCs in your state as one component of a comprehensive strategy to address the teen birth rate. You're interested in knowing where the school-based health centers are currently located in the state and whether or not they are in high-need counties. So there are 2 ways that I can do this. Since I'm already in the base maps and optional layers, I'll start by showing in the health policy section, you can highlight and outline counties that have a school-based health center, as well as counties that do not have a school-based health center. So I can see that it does look like there are some counties in Arkansas that are perhaps high need that do not currently have a school-based health center. If I want to dive deeper, I can go to SBHCs and school characteristics layer. Again, I can check the checkbox next to school-based health centers, and see the specific locations in Arkansas. And I want to assess the characteristics of some of those school-based health centers. For example, how many have a primary care and mental or behavioral health provider as a member of staff? To look at that, I can scroll down and see the school-based health center staffing profile. And I want to see only school-based health centers that have primary care and mental health. And I see that there are a few up here. Perhaps these are some centers that I would want to talk to further in order to see how they've been running their centers. So I can click on them and see some additional information. Again, we see some of the information that we're able to see in the pop-up boxes for public schools, but we can also see some additional information that's particular to school-based health centers. We can see what the sponsor type is, their staffing profile. Again, we just selected that we wanted to look only at those that have primary care and behavioral health. You can see their hours of operation per week, the grade level served, the populations, whether they have an electronic health record or after-hours care, and whether it serves adolescents. If I wanted to go back and see all the school-based health centers, I would just hit Reset and Show All. I can also see here free and reduced lunch eligibility. So this is for the school, and these sliders work by clicking on the hash mark, and you can use the arrows on your keyboard to move them to a particular percentage if you wanted to look only at those SBHCs that are serving a high proportion of free or reduced lunch eligible students. Okay, so to identify schools where I might consider opening new school-based health centers, the local task force wants to narrow down schools that serve adolescents and schools that are eligible for Title I funding in these high-need counties because you want to reach underserved populations. So to do that, I'll select the Public Schools button. And again, there are a lot of public schools. If I come down here in my bottom information bar, I can see the number of school-based health centers as well as the number of public schools that are being shown in these bright blue flags that are visible on the map right now. So if the task force is interested particularly in identifying some Title I eligible schools, which are schools that receive funding because they serve a large population of low-income students. So I'll just select eligible here, and we see that a few of the public schools go away. And then because I'm interested in targeting high schools in particular with potentially school-based health centers that would provide some expanded health services for teens in these areas, I'm going to filter by lowest grade level and look only at those that begin in 9th grade, and highest level, and I'll select 12th grade. So now we see that there's only 563 schools being shown in the visible area of the map. We also know that when we were looking at the medically underserved areas and the HPSAs, that southeast Arkansas might be a potential area to target. And we see that there are a few high schools in these counties, but there are no school-based health centers. So since I'm kind of narrowing in on this particular region, I can use this draw function. I'll go to outline only and select a rectangle. And if I just want to mark this on the map, so for planning purposes, I can find where I'm particularly interested, I can draw a rectangle around the schools and take this map to some other stakeholders where we might want to consider talking with them next to expand services. So I'm going to close out of the drawing tab. Now that I've assessed aspects of child and adolescent health, education, demographics, and socioeconomic status, we identified some high-need areas, examined characteristics of school-based health centers and public schools in Arkansas, and planned for the schools where we want to target some new services. Our team's ready to collaborate with other partners, as well as raise awareness for expanded SBHCs. So maybe I want to know if there are other hospitals, federally qualified health centers or lookalikes, or rural clinics in these areas that I could potentially partner with to sponsor a new school-based health center. I can go back to my base maps and optional layers, and I want to see 330 health program And I see that there are a variety in these areas. So if I wanted to, I could zoom in further to find out their names and connect with them specifically. Now the local task force has identified a potential funder who wants to know the teen birth rate for each county to be sure that the highest need areas are being targeted. To do that, I could look at the data table. So to do that, I go to my data tab. And here I can see a whole list of all of my different data points, the county names, and the specific information. If I wanted to, I could export this data and click here and download a CSV file. So the local task force wants to share this information with other people on the team. Now, you can either share this and you can get this URL, which will save a copy of the map so that you can come back to it if you wanted to edit it later, or provide it to members of your team. You could also print this map, and we recommend printing first to PDF so that it's highest quality, and you can even add a title to your map. It should print it with the legend, and it's helpful to provide some context when you walk through this with your other stakeholders. So before we open the floor for a discussion, I want to show you where you can find some additional training information and materials about the tool on our website and how you all will be able to log into the tool yourself. So when you go to our website, you can get to the mapping tool here underneath the resources tab. Here you can find some additional information about the tool, including how we framed the different functions and what some of the main layers are. You can find out more about the different data points that are included in the tool, as well as their definitions. You can go to the data sources. We also have a few different user manuals. We have this quick start guide, which shows you what the layout is of the tool, as well as a more detailed user manual. If you're interested in some of the other functions that come from the UDS mapper, you can also find some additional resources there. We have a few video tutorials, which we will continue adding to, so we encourage you to check back on those, as well as some frequently asked questions and options to register for a training. And you can go to the tool, and that will open the tool. And from the landing page, you can also open it there. So thank you so much for your time. We're really excited for you all to begin using the tool, and we'd love to hear any questions that you might have. So there was a question about having the slides available. So the initial Prezi that I did at the beginning is available as the first video that we have up under the video tutorials. This presentation is also being recorded, so you'll be able to watch it again that way. So while you all take a few minutes to think about questions, for me, I'd like to pose one to you all. I know we asked at the beginning if you had any thoughts about how you might be able to use the tool, or whether you might have colleagues or other groups that you work with. And I'd love to hear from you if after seeing the tool in action, it makes you have any ideas for how you could imagine using the tool in your work. And I'm also happy if there aren't particular questions. If there are things that the tools made you want to jump in and see, I'm happy to go to any particular states or counties and zoom in that way as well.
Okay, we do have a question. How can the tool be used to show oral health services in the area?
That's a great question. So I'm just going to pull the tool back up here and get rid of some of these other things that we currently have shown on here. That's the screen. There we go. Showing the screen again. So there's a couple options for looking at oral health services. One option, there we can see health professional shortage areas for oral health providers. So you can see that in the base maps and optional layers. Unfortunately, one limitation of the tool in terms of data on oral health at the county level, here in the child health and education indicators, we had to include indicators that were available at the county level for all states nationally. So if you know of an oral health indicator that you think would be interesting, we would love to hear that. But otherwise, another option to see some oral health data would be to go to tools, and you could go to Map My Communities data. And there you would be able to upload your own data on oral health, and we're certainly happy to provide technical assistance on that. And uploading your own data will be the subject of some future, more advanced user webinars.
All right, another question is, what is the best way to see where there are school-based health services, but those services do not include mental health?
Okay. Also a great question. So again, I'm going to go back and turn off the HPSAs. So the best way to see school health services right now is to select school-based health centers. If you want to see where there are school-based health centers that don't include mental health services, you can go to SBHC staffing profiles. Again, I encourage everyone to get familiar with these information buttons that give you a little bit more detail about each of the indicators. And if you wanted to see where there are school-based health centers that don't include mental health, you can select on primary care only. And that means that they provide primary care, but that school-based health center does not include a behavioral health provider as a member of staff. Great. We have a few ideas coming in about how to use. Some users might see themselves using the tool in the future. So I'll just share one example. We're looking to help educational public agencies with the IDEA notification and consent requirements for Medicaid and insurance. This tool may help to identify states and districts that could use help. That's a fabulous idea, and I encourage you to use the tool and reach out to research at sbhforall.org with any questions. And we also encourage people, once they start making maps, to share those with us. There's a question about whether the tool provides any information on substance abuse. That's a wonderful question, and certainly a very important public health topic. Let me start by saying that in the child health and education indicators layer, we unfortunately don't have any data already in there about substance use or abuse. In the base maps and optional layers, I would say the closest option is you can find substance abuse treatment centers that might be in a particular area. But that is something that if you had a particular state that you are interested in, we'd be happy to help talk with you about uploading some of your own data at a county, zip code, or other level.
Okay, we want to give others another couple of minutes. If they will have a few questions, they can enter them now. Okay, while we definitely we're waiting for others to input any questions that they may have, like Erin said, please visit our site at sbhforall.org. We also want to encourage everyone, once you visit our site and you're interested in all this great information, please, we encourage everyone to please become a member at School-Based Health Alliance, where we offer great opportunities to improve the health and status of children and youth by advancing and advocating in school-based health care. Our members extend and support our work. We ask that you please join us. And also for the membership, organizational memberships are $500 a year, include discounts on professional services and products, letters of support for grants, newsletters, and more. Individual membership is $100. We ask that you please join us. For more information about membership, again, please go onto our website at sbhforall.org. Okay, do we have any more questions? We'll give you a few more seconds to enter them if you do have any questions.
Right. Well, if there are not more questions, we encourage you to continue to reach out again at research@sbhforall.org as you begin using the tool or with any questions. Please share this with your teams, and we look forward to hearing about how you've used the tool. We really appreciate you all joining us for our introduction and first webinar here today. You can check back to our website for future webinars, upcoming video blogs about how to use the tool, and more. So Tiara has a couple poll questions for you all, and thank you again.
Okay, our first question, we'd like to know, did this presentation meet your needs? If you can please just take a few seconds. Okay, thank you, everyone. Our next question is, how well did the presentation meet the stated objectives? If you can please answer. Thank you again, everyone. How likely are you to apply the information from the presentation in your organization? Please take a few seconds. Thank you, everyone. And our final question, would you recommend this webinar to others? Please take a few seconds. Okay, we would like to thank you all for attending today's webinar. Again, please if you have any questions or additional comments, please visit or send an email to research@sbhforall.org, or you can visit our website directly for more information about the mapping tool at sbhforall.org. Again, thank you to Erin Scheller for this amazing, informative presentation. You all have a wonderful day.